Okay, so we'll go ahead and get started. Good morning or good afternoon, all, depending on where you are. And thank you all for joining us. And a special thanks to Martha Kelso for being our speaker today, here to talk about adopting fluorescence imaging for detection of elevated bacterial burden as a standard of care across her long-term care facilities. Martha Kelso is the Chief Executive Officer of WoundCare Plus. A little bit of housekeeping. We will have a Q&A after the presentation. So please everyone find your chat icon. And if there's any questions that you have, please drop them into the chat and we'll try and get through as many as we can in the time that we have. Okay. So with that, let's get started. Thank you so much, Martha, for being here.
Thanks for having me. I'm excited to talk about some of the interesting things that we've discovered by adopting MolecuLight and using it in our long-term care facilities. Although it's been a short stint because, of course, we were able to get approval from Medicare to start performing this modality in the long-term care sector where we currently operate. It's been an interesting experience that I'm happy to share with others. Thank you. I want to talk just for a moment about the elderly and some of the effects of aging on the immune system. I've been doing advanced wound care in the long-term care sector for over a decade. So we see that the immune system of the elderly becomes slower as they age. That means the immune system becomes slower to respond. We know the elderly, because of their age and the effects on the immune system, can develop autoimmune disorders. I'm sure several of you have seen this in your practice, things like bullous pemphigoid or other autoimmune disorders that can attack the skin or other organs. We know with the aging or aged population, the body may heal slower. We have fewer immune cells in the body to bring about healing. Oftentimes we're finding those barriers and trying to eliminate as many barriers as we can, but obviously age has a major effect on barriers to wound healing. The immune system's ability in the elderly create issues detecting and correcting cell deficits or defects. It also can create some declines. We know polypharmacy is rampant in the long-term care sector, and we know certain medications can delay wound healing or even cause wounds or breakdown in the skin. Let's move on to the next slide. I think it's interesting to know that skin infections are the third most common type of infections in seniors. The effects of the aging on the immune system can cause infectious diseases as one of the most common causes of increased morbidity and mortality in elderly patients. I know many of you have seen that in your practice. And because the elderly, their fever response is often blunted in the presence of bacteremia, sometimes we're not getting that infection diagnosed until they're already septic. Pressure ulcer infections are most frequent in patients living in nursing homes. And 1/3 of all deaths in seniors over 65 are a result from infectious disease. Many elderly, however, present with nonspecific clinical symptoms and nonspecific functional decline, which makes an accurate diagnosis difficult and may lead to life-threatening delay of diagnosis and therapy. Traditionally in the medical field, we're trained to rely on those clinical signs and symptoms of infection: fever, redness that's spreading, maybe the peri-wound is hot to touch, purulent drainage. And in the elderly population, in my experience, many of those clinical signs and symptoms are missing or significantly delayed, even in the presence of bacteria. And it leads us to often guess whether or not the wound is infected. Should we do a culture? Do we need to get them on antibiotics? And sometimes we find out when it's already too late. So enhancing wound assessment with MolecuLight becomes critically important. We know that MolecuLight has that point of care fluorescence imaging device that detects bacteria in 10 to the fourth power. 10 to the fourth power is important because that means clinically infected. Clinical infection means that we need to do something about it. We're not talking about bacteria that is colonized in the wound. We're talking about bacteria that's actually causing a problem. We know that MolecuLight enhances our wound assessment and supports that point of care wound assessment and documentation. It's handheld, it's portable, and it's a touch screen. That means it's not difficult to use. There's no contrast agents, it's non-invasive, and there's no patient contact required. So in my experience in the long-term care sector, it takes just a handful of minutes to be able to determine if that fluorescence imaging is detecting elevated bacterial load. It takes the guesswork out for me. I'm not having to guess if we have 10 to the fourth power in that wound. And that's pretty remarkable. Let's move on to the next slide. Let's look at what MolecuLight shows. Our standard image, of course, we have this cute little wound, doesn't look scary. We're not looking at those clinical signs and symptoms of infection for this photo. I'm not seeing a heralding sign in the peri-wound. I'm not seeing peri-wound tissue that's red and angry. The wound bed looks clean. It's got that beefy granulation tissue. Yes, there's a callus formation. Yes, it is most likely on a diabetic limb, but I'm not seeing anything scary. And yet we do our wound assessment and then our fluorescent image, and we see very clearly that we have elevated bacterial loads fluorescing with red signals. Those red signals tell me the bacterial level is 10 to the fourth power, and a clinical assessment and further diagnostic is probably warranted, most likely a tissue culture, or perhaps the advanced wound clinician would decide to debride, maybe pair the callus, but it allows you to decide to do additional workup. This is one of our photos from my company, WoundCare Plus. And this is the changing outcomes with bacterial fluoroscopy that's so critical. Now, we didn't show the pre-debridement photo because the post-debridement photo is what's most important in this picture. As a wound clinician, going back several decades, I look at this post-debridement photo and I think, what a brilliant debridement. There's no slough, there's no angry tissue. I would fully expect this wound to go on and heal in the next week or two. The debridement's great. We've got bleeding accomplished. I'm super happy with that. And then we perform bacterial fluoroscopy. Just one last time, just before we walk away from this person, let's see if there's anything else ugly and hiding under there. And sure enough, we find this red fluorescing image on the MolecuLight device. That clued the clinician in that something was hiding under there. So she numbed up the area, put a scalpel in, and found a hidden abscess. That hidden abscess is so close to the rectum. It is so close to creating a much bigger issue, a possible fistula formation, if we had let this go for one more week. And so that thought of, man, this wound looks great, we're super excited, suddenly becomes, wow, the outcome of this wound literally changed because we had bacterial fluoroscopy at the bedside. Next slide. Thank you. Another one of our real cases, again, this is a heel wound. It looks great, we're excited. The clinician was having a hard time trying to decide if this was epithelial tissue or slough. It was on the fence. So what was interesting was through targeted debridement, we were able to determine that was slough in the wound, and we were also able to find an area of red fluorescence. That's important because due to the elevated bacterial load, because of the bacterial fluorescence, the fluorescence imaging, therefore the elevated bacterial load, we were able to do a targeted culture of that spot, the little red fluorescing spot. We easily could have missed the bacteria in the wound, possibly cultured a different part of the wound, and the culture would have come back negative instead of culturing where there was that red fluorescence. Next slide. It's what I like to call guesswork gone. So again, here's a significant pressure ulcer on the sacral area. And for the most part, it's red and beefy. It looks good. It looks like we're just waiting on good fillers. It looks like we're waiting on this wound to fill in. And yet we do a targeted fluorescence imaging. We were able to detect bacterial load. And throughout that bacterial load, it allowed the provider to focus on the areas that were fluorescing to remove unhealthy tissue. So she felt like she did a really great debridement. She felt like things were great. And on the next slide, you'll see that she did the bacterial load, looking for fluorescent imaging again. Sure enough, there was more areas that were fluorescing. So through that fluorescing, she was able to do another targeted debridement to clean up the wound and remove more areas that she didn't feel safe leaving in the wound bed. Guesswork gone. So in the elderly, where we are worried about their immunocompromised state, not always helping direct us through those clinical signs and symptoms, MolecuLight has helped us get rid of the guesswork and help heal wounds quicker, safer, faster, stronger, so to speak. I should be ready to take questions now. Thank you so much.
Thank you so much, Martha. We do have one question that's come in through another channel, and it is, can the MolecuLight device be taken into long-term care facilities? And by that, they mean, is it portable?
It is portable. We traditionally chart on iPads at WoundCare Plus. It's more portable than our iPads. It fits in our pocket quite nicely. Okay. Great question.
And Martha, could you comment, could you give an estimate, how often would the images impact the treatment plan for a given patient?
The clinicians that are currently utilizing it in our groups estimate that anywhere from 80 to 95% of the time it's changing their treatment plan. So they're walking in, looking at a wound, they're thinking, okay, here's what I need to do. And then they perform MolecuLight after they've already done their wound assessment and documentation. And between 80 to 95% of the time, it's changing what they thought. So the examples that we reviewed in this presentation were some of those times where 100% of the time it was changing it. Each one of those photos, it changed what that provider was doing. And that's critical. I mean, medical, legal, healing the elderly, making sure we're giving good care, making sure that we're being responsible to payers that are paying us to heal these people timely. I mean, the ripple effect is pretty massive.
Thank you. That's tremendous to hear. Martha, I see a question about access through reimbursement. So is this reimbursable at all?
It is reimbursable through certain payers. I'm not sure which MAC or Medicare territory you're in, but I have been at the forefront of petitioning some of these payers to ensure that they are giving us coverage. And we have been successful. So MolecuLight would be able to help you with reimbursement on who's paying, who's not. And if you want to help be a champion for reimbursement, maybe you want to help submit letters to carriers that you work intimately with to help procure reimbursement and with payers that are not currently covering it. So I'm throwing that out there. Any wound champions that want to help pause for the cause, we welcome your input.
Martha, what I've put up a slide here with the 2 CPT codes for the procedure, and it shows that it's carrier priced, and it does have an APC assignment, and the payments listed there. Can you comment on skilled nursing facility consolidated billing?
Sure. In my neck of the woods, which the majority of our practice is in WPS territory, so I'm going to speak from experience. I'm taking off my MolecuLight hat and putting on my WoundCare Plus hat. WPS is currently paying us in place of service code 32, so long-term care. And as of January 1st, 2021, they have unbundled the payment so that we are allowed to do it and get reimbursed from Medicare on Med-A skilled patients as well. And that's huge. So part of that consolidated billing, it's no longer consolidated. It's what they would refer to as unbundled.
Right, fantastic, fantastic. Well, unfortunately, we're out of time. This goes so quickly, 15 minutes. So thank you so much, Martha. Thank you so much to everyone who joined. And I will direct you to the MolecuLight booth at the WoundCon show, where you can have additional questions answered, collect some material, and catch some additional presentations that are happening later in the day. Thanks so much, everyone.
Good. Thank you.